All right. Good
Hi.
afternoon. We are live from Houston today. Rachel and I are here to present at the AVTE conference, which is the Association of Veterinary Technician Educators. So that's where I am today. That's why my backdrop is a little different. And are here with Betsy Redmond from Innovative Pet Labs, and we're going to learn about their products and how they're different from regular microbiome testing
hmm
and why they're so important. I'm really excited for this topic. Um, just to get started, we do have a comments list. If you guys have any questions, feel free to put comments into the comment section, the chat section, and we will get to those. We normally run 30 to 40 minutes, and then we'll do a Q&A after. And you can always stream this after the live. We'll have it up on Facebook, and you can go back and listen to the information again because I'm sure we're going to get a lot of it. And I always go back and listen to it a second time, and I encourage all of you to do that too. So we're going to go ahead and get started. And Betsy, I'm going to have you start out by telling us how you got here into this animal sector because you had started
Yeah,
in the human
yeah,
sector.
yeah. I had worked in people. I worked, in big population studies. I had a private practice, and then I started working in integrative and functional laboratories.
Mm.
So Metametrics was the first one, and it was family owned. It was finally bought out, like everything else, by a big company, private equity. So I worked there a little bit longer and went to another one. But I had worked with a group of people for a while, and I had a dog who had what the vet had just called a blossoming anus. So it was, like an IBD kind of thing. So I wanted to test her. And we'd had vets who tested before. Like certainly when we were in the smaller company, the big company wasn't really into it, but who would send samples in, and we did other samples, polar bears when they were sleeping, like their fatty acid levels pre and post hibernation.
Uh-huh.
But then, so we'd have a few vets send in for organic acids or, stool testing. But we didn't have reference ranges.
Mm.
So we had people reference range and we didn't know what they would be. So when my dog, Linda, started getting sick, I wanted to test her. And we were all like, hey, well, why don't we just start?
Yeah.
This is what we do. Together we have 100 years experience. We know how to do lab testing. So we just started the company, IPL.
Okay.
So yeah,
Interesting.
it's predominantly female owned and
Uh-huh. And
it's
how long has it been testing?
about 2 years. I mean,
Okay.
it's been longer than that. To be honest, the IT stuff's been tougher. At first, we were pretty excited because there's a lot of ominous kind of stuff with people labs.
Mm.
There's all the HIPAA rules and everything. And we treat ours like we follow general HIPAA rules. We treat it like a CLIA certified lab, but there is not a CLIA certification for labs.
Okay.
So anybody can start a pet lab and say, we're testing vibrations or, whatever they want to say. So we just took all the same skill sets we knew and put them in pet and just
Nice.
started collecting. So we've been doing it about 2 years.
So how are you developing your own reference ranges? Did you
We
find
develop our own reference ranges.
okay.
Yes.
And that's just with all the different animals that
Yeah, all the different animals. We all, we keep a lot of samples. We are friendly with vets who have certain types of pets. We also compare that to reference ranges in the literature.
okay.
So when we set stuff, and sometimes there's kits, and the kits will have a broad range. So, we're not just coming up with one, we're checking different sources to
Sure.
make sure.
So do you recommend this is something we should test early in our dogs' lives and have like a baseline, or when do you recommend starting this kind of testing?
Yeah, I mean, for most dogs, we're thinking about a year you should start.
Okay.
And we do two different things. I mean, and we are actually working on puppy reference ranges. We just have to get enough puppies over, that first year and see what does that look like? How does that change? So like babies when they're born, like one of the markers we look at, calprotectant, it's an inflammatory marker. Babies are born with, human babies are born with super high calprotectin levels.
Huh.
And I don't know if that's like part of the immune system, just starting out on guard or something. But so we don't know, how that's going to be with puppies and when it would come down. So we're just starting to look at that. But we usually say like a year.
Okay.
So
what about a dog that's been through a lot of traumatic events? At what point should you? So I'll give you a good example. My dog,
okay.
I got her in March, but she was a rescue. And in December, she went through a spay, updating all her vaccines, microchipped, all of those things. And then she was kept in on rescue for 3 months before I got her. And then when I got her, I transitioned her to fresh feeding. So she's been through a lot. I've had her for 4 months now, and I'm still battling a couple of things like some skin issues and some ear issues.
Mm-hmm. Yeah, there's different types of tests. You can do testing. Some people, their dogs seem fine to them and they're doing everything that they think is right.
Mm-hmm.
But they want to test just to see what, is it all correct? Because we're not looking at microbiome. So that's something different. We're not looking at gut bacteria. In the human world, we started one of the first tests to look at gut bacteria in the human world for clinicians. But that test also looked at functional markers. So when we decided to come to market with a test, we decided to use a test that looked at functional markers because we felt they were more actionable. The gut bacteria patterns and which ones you see are really interesting. Mm-hmm. But sometimes you might see a pattern for inflammation, whereas like a marker like calprotectant will identify the actual inflammation.
Okay.
So we're looking at markers that tell a story of more about the function than the actual. And we have some markers, that will, if they're high, will say you should look at the gut bacteria.
Okay. And do you do that testing too, or are you just looking at the functional markers?
We just look at the functional markers. Yeah.
Okay. So you'd have a different lab you'd have to do the microbiome testing.
Mm-hmm. Right. But I think, a lot of times it could be dysbiosis, but, you're really going to do a lot of the same treatments. Mm-hmm. But as far as who to test,
okay.
If it's so some people will test and just to make sure everything they're doing actually is right. Mm-hmm. Because like people, dogs aren't going to be, great one day and have some severe enteropathy the next day. It's a progression. They don't just show up with pancreatitis and the day before everything was perfect. So it does, it's a progression. So we can see along that progression. So if a dog that has symptoms, we think of dogs that have, gut symptoms like diarrhea or constipation, but also mood disorders or skin issues. Those are big things in people too. There's, the gut is connected to a lot of areas.
So with a dog that's been through that kind of trauma, how long should you wait? Is it an immediate thing and then track it?
Well, I wouldn't wait at all. I would do it and see what the status is.
Okay.
Like, has all this trauma caused gut issues? Is there inflammation, or are there gut issues that are continuing the trauma type of reaction?
Mm-hmm. Okay. That's really good to know. And so the specific biomarkers that you're using, can you really explain what that means?
Yeah. So we look at, I think I have one here. So we have a comprehensive test and it's got 6 markers.
Okay.
And so that's really what we recommend. We have, one for cats that has 4 markers, but that will throw a wide net. And then if there are certain issues, you can follow up, and we've put those into different kits. So it's inflammation and immunity. So this looks at, for inflammation, we're looking at fecal calprotectant. Okay. And calprotectant is a direct marker. It identifies neutrophil or white blood cell infiltration into the gut lining. And they've done studies in people and in dogs where they do scopes and they look at biopsies, and they can correlate the level of calprotectant with the level of inflammation.
Mm-hmm.
So we can identify how much inflammation, if there's inflammation, how much inflammation is there. And then with treatment, you can see the inflammation come down.
And what would a treatment for that be?
Well, they have it broken up. And if you look at like a standard vet, PubMed article from a vet school, they have it like three main ones. They have food responsive,
Mm-hmm.
they have antibiotic responsive, and they have like steroid, biologics responsive, and then they have non-responsive. But so depending on how high it is, they kind of pick, which one. And it's going to make a difference. If you have a dog who's lost a lot of weight and things, you may want to get in there with some pharmaceutical. But we generally find pretty good response with, changing diets, even getting anti-inflammatories, curcumins, looking at the other factors. You're not going to necessarily see a super high calprotectant all by itself. There are going to be other things, immune reactions, leaky gut going on.
Okay.
So it what you do kind of depends on how high the calprotectin is,
Mm-hmm.
and what symptoms the dog may be having, and also where they're starting. If there was somebody on, Old Roy or whatever, some kind of kibble dog food, and that's all they had, then, maybe starting introducing some things, so I think that's also important to kind of make changes slowly and not just show up the next day with, but yeah, so it kind of is a lot of factors. So for some dogs who have a little bit of inflammation, introducing anti-inflammatory supplements can be helpful.
And what kind of anti-inflammatory supplements are you referring to?
Or like a curcumin type of thing.
Okay.
Or, sometimes you'll see stuff that has like glutamine or some gut soothing or, slippery elm, those kind of things.
Okay. And so you would recommend a whole food supplementation rather than looking at pharmaceuticals or?
Well, I mean, part of it depends. If you had a dog that had super high levels and they'd had weight loss and they have other things, I'd certainly probably look into, I guess it depends on the severity. I always think it's worth trying a diet change and supplements first.
Okay.
Unless there's just something so severe about it. And then you can test in a month or so and see, hey, is that making the difference? And
when clients or patients send in their sample, is there a survey or something they fill out so that you know what kind of food they're feeding? And
we ask a few questions where, that's one of the big things about starting a business. We're like, we know labs, and it's like, oh, we don't know IT. So we are developing some more so we can just have that, more extensive data, but we do ask about diet and general symptoms. Okay. So, we can kind of start to collect that. And we've done some studies. We did a pretty big study with some cats.
Okay. So you're keeping track of that data and creating maybe reference ranges that way too. And
yeah. So we're always, we don't like to update reference ranges too often just because that gets messy. But usually about once a year, we do a deep dive into all that we've collected, looking at different pets, different additional reference range markers.
Nice.
And you'll see, like in calprotectant, above a certain value is high. And then a small, I'm pulling this off the top of my head because I can't remember right now, but I think it's below 10 is good. And then above 100 is high. But the borderline is like 10 to 100, if I'm remembering correctly. Mm-hmm. The borderline is big, like it might be high, might not. It's higher than most. And that's because there hasn't been extensive research on when it's too high. So if you look at calprotectant and it's borderline, look and see, are there other things elevated with it? Are there more severe symptoms? So a 50 in one dog may be like, well, I just run high or whatever, and it may be okay. And in another dog, it may be pretty significant.
What other clinical signs would you see in that case? If you're looking, and let's say you do have a dog that's in that higher range, and you say, well, what else is going on? What would you
Yeah. Oh, sorry. My husband's
Okay.
walking in right now. It's just going to be a second.
That's okay.
Okay, he's in. It's like, yeah, working at home. It's so easy. But yeah, I mean, I think that, it's I would expect to see like weight loss if it was more serious. Because if there's a lot of inflammation right there at the gut, it's going to impair absorption. So you may not be absorbing, maybe you're getting enough calories, but you might not get all the nutrients.
Mm-hmm.
It's also really tightly, all those enterocytes and villi are really tightly tied to the immune system. So there may be, with calprotectin's high, there is an immune reaction. But there's also, within those enterocytes, there's mucus producing cells. And so you need a certain amount of mucus in the gut. So I'd certainly look at just, weight and nutritional status. Are they absorbing all those things?
Mm-hmm.
And then if the immune system is highlighted, are they having immune reactions to certain things they didn't used to? Are they reacting to certain foods or environmental stuff that they didn't used to react to? So we think about skin conditions and then mood change. So those are really the big ones, and the severity of those: skin, the mood, and then just the gut in general. Are they having a lot of diarrhea?
Yeah. So would this be a good way to, like, you have a high level and you think, okay, this would be a good time to start doing like an elimination diet. Let's see if taking chicken out of there is going
right. Yeah, it could be. Yeah. So we're thinking about, look at different proteins.
Mm-hmm.
And so, especially an inflamed gut, so it may be more responsive. If you've had chicken and chicken and chicken, and then, you have an inflamed gut, you may be responding to like, okay, this chicken protein is really bothering me.
Mm-hmm.
And it may not be that you can never have chicken again. It just may be that during this inflammatory phase, you're going to want to switch to something else, a different protein.
Yeah, that makes sense. So that they could see what's going on, food sensitivity wise, food, maybe allergies, which there are not really that many food allergies, intolerances, that kind of thing. So it says, is there a specific type of stool sample that is considered the most informative as far as revealing for gut health? For example, if a dog has diarrhea, is that a good
right? We do, just in order to get the test like to work, you don't want it to be too dilute. So we generally say we want it like peanut butter consistency at least. I could make a peanut butter sandwich right after I say that. I don't think my own girls would be like, that's gross.
Yeah. No, those of us that have been seasoned in this, it doesn't matter. Soft serve,
Right, yeah. So at least it's got some weight to it. Like, we don't want it really watery. And so this is the tube that so you get it, it comes in the box, and you open the box and it's got this thing. You've got to register it so we know who it is.
Sure. Yeah.
But then it's got this spork. We also have a little wooden thing. And we have a red line. It's nice to get it to the red line, but it's not necessary. We need just a small sampling. But so we just need it to have some consistency. So you can't have really watery. And you just put it in the regular post office. You don't have to go to FedEx. When we were first developing the test, none of us could make it to FedEx. I'm too busy to get to FedEx. I can't. So we're like, we need to do it from the mailbox. If we are starting a business and we can't even get there.
Right. I'm trying to make it as easy for your
right. And so what we say, like, it can stay out for a couple days.
Okay.
But in our instructions, we say for 20, if you're not going to send it within 24 hours, put it in the freezer and then send it. Cause then it's good indefinitely in the freezer if it's frozen. But, otherwise, if you can't send it, freeze it. But
yeah, that's another thing that people will freak out about.
Oh yeah, I was going to say, I've definitely got poop in my freezer right now. Yeah, because I did my dog like when we first started, like morning, night, every day for like 10 days. Like, I want to see what's the variation.
That's hilarious. Yeah. So we have one question that says, can you talk about leaky gut dysbiosis in pets and what specific benefits this testing offers in terms of managing this? So,
yes. So, and I will say, like, the other marker in this, besides the calprotectant for inflammation, is the immunity, is secretory IgA.
Okay.
So secretory IgA is the first line of defense at the gut lining.
Hmm.
It generally is going to be like good friends with the commensals, and it'll come out and hang out with all the commensal bacteria. So you want it at a decent level.
Okay.
But if it sees something like a parasite, a pathogen, a parasite, a virus, a food reaction, and then it'll jump up.
Okay.
So if it's high, there could be a reason. I think what's always more concerning is when it gets low. It's like, I can't even do it. I've run out. But so I'm always looking at that. But we do have a test that's specifically leaky gut, and that looks at the main marker it looks at is zonulin. So zonulin gets secreted. I think everybody's most familiar with zonulin getting secreted with gluten. So a reaction to gluten. And it can, and that's anybody. Like Fasano is the scientist who first discovered that, and he said, like, anybody who eats a whole pizza or something is going to have some gluten put out. But some people make more, just like dogs. And so gluten is one reaction, but there's some gut bacteria that also make it. But the problem with it is that it likes to pull off the tight junctions that hold cells together. So if these are each enterocytes and they're being held together with tight junctions, zonulin will kind of pluck those off. So then the cells are open. So then there's just kind of, less control, like open borders. And, so the immune system just can't check, as quickly what's coming in. So you'll often see it with other markers. So the other thing that we look at besides zonulin is antigliadin. So we're looking at IgA antibodies to gliadin, which is a component of gluten.
Okay.
So, and sometimes you'll see dogs who are gluten-free. There are some proteins, if the immune system is really overreactive, that might get folded and look similar. So it's just really identifying an immune reaction.
Okay. And so can you explain a little more for people, like what leaky gut really means? I think we all hear it, and you were talking about the junctions.
Yes.
But
I've never done a talk where I don't do my enterocytes. Well, and then there's enterocytes, and the enterocytes, like, they're all over the villi.
Okay.
So different villi, and there's different conditions that can, shorten the villi themselves, and then the enterocytes, their function can be impacted. So when the tight junctions are pulled off, and they don't all just get pulled off, but some of them. So there's just, if things are supposed to go through, and there's usually a tight junction, and then there's usually something else at the bottom that also watches it. So it's orderly, like, somebody checks it, and sometimes there'll be things coming up from the cells, like the intestinal, to check, like, what's going on up there. And so when things are not there, larger proteins can get through than normally come through, things you wouldn't let in. Because if you think about the gut lumen, where the poop actually is, that's considered outside the body.
Yes.
So there's that immune system. When they say 70% of the immune system is in the gut, part of that is the immune system is just checking everything, like who's coming in. Like, they want to pull all the nutrients out, but they don't want just whatever component to just come right in. So with leaky gut, it's associated with increased immune reactions to foods. So if certain proteins get in that are too big. So when zonulin's high, we're thinking of making sure there's no inflammation, checking to see if there's any, gluten intolerance, and then just trying to help those. I think some of the big things are like, aloe, marshmallow. They have certain products out there. I don't know if I can name products, but there's
yeah, you can name anything.
Ph.D. has a really nice product that I like, and it's got like glutamine and aloe and different things, marshmallow, that can help with the gut lining. I actually forget what it's called. 4-leaf rover has some of those. So looking for those things. When oftentimes you'll see zonulin high, and secretory IgA is also high. For secretory IgA, one of the things, low, sorry. When secretory IgA is low, one of the things that can really help it is Saccharomyces boulardii.
Yes.
And that's a good yeast. And so that can be in there. And that can be helpful in bringing that, supporting that, and then supporting the secretory IgA because it's so active at the gut lining and helping soothe the gut, the zonulin, like the gut lining. That can be helpful. I mean, occasionally we'll see a pet that has a lot of these things going on. So usually it's just, it's one or two at a moderate level, because most of the people who are doing our test to date are people who are pretty concerned with their dogs.
Sure. So do they get a report that really, sums up everything and says these are
we have a lot of education on our website, and the report will come. So we run roughly every 12 days. And so if you get your test report in right when we're about to run, it could be one day, but it could be 12 days.
Okay.
So you'll get an email, and it will be, it will have each of the markers, what we did, what the ranges are, what's normal, what's borderline, what's high, where the pet is, has a little blurb. It also has a little thing you can click that will tell you a little bit more, and then you can click to more detail. So we have just more, you can get deeper and deeper.
Mm-hmm.
And so each of the results will have that. You can also, we do it so you can, if people do it themselves, they can print it as a PDF. We're going to get it so you can just, forward it. But right now they'll need to print it.
Okay.
So because we do 3 different ways. We do direct to consumer, so anybody can buy our tests online. Mm-hmm. We do vet accounts, so people who are working, vet and vet techs who are working with people, and then we have wholesale and stores.
Oh, okay.
So so there's different ways. So you can get kits and pass them out. You can or direct people to the website.
Do you have a lot of veterinarians using this at this point?
We have quite a few, yeah.
Okay.
Yeah. And so, there's also, I think there's some opportunity for income too, because you've got to define those tests. Because one of the things we found, like we came out direct to consumer, we loved it. And then people were like, wait a second, I don't know what to do with this. And that's when we were like, oh, okay, we're going to have to help people. It's like just getting, if people go to the doctor and they send them a big long lab report, if you don't know that, it's going to be like, I don't know what this means. And even if you look it up, what's normal kind of thing.
Yeah. So that's it. That was my next question. Do you offer consultations?
Right. We have different consultations. I mean, you can always email us and ask questions, but we do have vets and then, some vet groups that work, and they're on our page. So you can go to our, our favorites kind of thing. So we have like some of our favorite products. We have some of, and then if you have more questions, there are vets that are familiar with our tests.
And they would work with clients virtually.
Mm-hmm. Generally, yeah. I mean, sometimes you can find some that are right in your city, but usually.
Yeah, it's really hard depending on where you live. And I live in the Nashville, Tennessee area, and luckily we have several holistic vets, but I know other people have had a really hard time finding anyone that will even entertain this kind of thing, especially, between the microbiome testing and then even advanced testing like this. They just want to put them on metronidazole or Flagyl. And
yeah, they do. And there's a recent article out about like, don't keep doing metronidazole. It's not going to be helpful in the long run. Figure out what's going on and adjust.
Yeah, I love that. I had a friend that I could not get her to listen. Every 3 months that dog was back on metronidazole, and it's just so sad. I mean,
it does work immediately.
Right. But consequences. Yeah, that's what's so hard. I think that's where the education side of all of this has to come in, and anything we're doing holistically, it's not immediate.
Right. Yeah. But it's better long-term.
Mm-hmm.
The people who go on metronidazole every 3 months, you're going to need to kind of get those bacteria back. And I think in people, there's good research, like if you just pound probiotics, then it's going to take longer for your own gut bacteria to get where it's supposed to be.
Mm-hmm.
That you're really probably better off doing like polyphenols and prebiotics to build those things up.
Sure. So can you give us examples of that?
Well, like if someone's been on something that's killed off all their bacteria, or you just suspect they need to build that, I would just, even adding, a few blueberries or pumpkin, those are good polyphenols. There's good, there's some, polyphenol products. There's a lot of products out there too that have like prebiotics, certain fibers, and polyphenols combined.
Mm-hmm.
So, maybe starting with low doses of those, building those up, and you can build up gut bacteria, as opposed to if you just give probiotics, like those bacteria, they're not going to take up residence. They're just there as long as they're taking the probiotic. Yes. So they don't, and they do things when they're there, but generally building up the gut bacteria that the pet has is going to make more sense.
So if you are doing probiotics, you need to be doing prebiotics also to feed those.
Right, right. You're going to be, yeah. I mean, eventually, ideally, you'd want to have a diet that supported good gut bacteria and not have to have the probiotics. I mean, that can be hard. My dog doesn't go, it goes outside, but I live in the middle of the city, so it's on a sidewalk.
Sure. Yeah.
It's not getting a bunch of dirt or running around in the woods.
Mm-hmm. Yeah, I think that's a common misconception, that if I'm giving my dog probiotics all the time, that its gut is going to be healthy. But that's not the case now, necessarily.
Yeah, I mean, there's certainly, research out there that dogs who weren't well and they gave them probiotics, that it can help, but it's not really fixing the problem, because they're just going to have to stay on the probiotics. So trying to get some prebiotic fibers and polyphenols, and polyphenols are prebiotics. They just tend to be a little bit lighter.
Okay.
So certainly, like, I don't know if anybody's ever done that, where it happens with pets too, people, like if you suddenly like, I'm going to eat a bunch of fiber, and you just doubled your fiber intake, that's going to be hard. Sure. You have a lot of symptoms. So you tend to have fewer symptoms from doubling up on polyphenol intake than you would on fiber. So sometimes that's an easier way to start with things.
Sure. And I mean, with our dogs, we should always do things gradually and not overdo it. I think it's hard because sometimes you're like, oh, I just want to get this, taken care of. We do have one question I'm going to go ahead and show. So basically is asking, what can we do with this dog that has had diarrhea off and on? Do you have specific suggestions or?
Well, I would, we generally will say get the, you could always try changing diet. I mean, 10 months old, I think that's getting pretty close to where we are, that we could have that. If it were me, I would, I would probably run the comprehensive test. Okay. If you want to wait, we say a year, because that's just, we kind of have picked that, since we haven't done that full research on when they would change. But 10 months is getting pretty close to being up there. And so I would probably want to do the comprehensive, Otherwise, if you're not ready for testing, I think looking at diet changes, slowly changing proteins, looking at gut lining support.
And this would be a great one for those prebiotics and polyphenols.
Right, right. And I think also, one of the other things we look at is pancreatic elastase.
Okay.
We have another test report. I have them all.
And what is that? And what is that looking at?
That digestion and detox. So the digestion part is looking at pancreatic elastase. So elastase is a proteolytic enzyme. So it digests protein. Okay. And it gets released from the pancreas along with lipase and amylase, but it's more stable than the other ones. So it's used as an overall marker of pancreatic function.
Oh, okay.
And so, it's part of a spectrum. So pancreatic elastase can start to go first. If you see it really low, it's more of a insufficiency. In the human world, they're starting to look at, maybe we should grade it, the pancreatic elastase level as, a little bit impaired pancreatic function or a lot of pancreatic insufficiency, because in the human world, you can use pancreatic elastase to diagnose EPI, or exocrine pancreatic insufficiency. In the pet world, you're going to use some other markers for diagnosis for that.
Okay.
So if you have a low fecal pancreatic elastase in a pet, it doesn't necessarily mean that they have total pancreatic insufficiency or pancreatitis, but you're going to see that marker low in those. It's kind of the first one to start to go down.
So then you'd want to be able to support that pancreas,
right?
Getting that kind of test.
Right. So we've had cases where people's dogs seem okay, and then they realize, their pancreatic elastase is low. They provide some supplements, and it makes a difference. It's not always going to be dogs who have massive diarrhea and weight loss, but it can, just a little bit down, and it can, supplying enzymes can be helpful.
Okay.
So that's also, especially with diarrhea, sometimes I think that maybe the digestive enzymes would help.
Exactly.
Because you're going to have is stomach acid good? Because it's actually pro-elastase goes to elastase. So it's, you need that whole digestive cascade. Aging, all the organs slow down as you get older. So that's for pets too. So that can have an impact.
Interesting. So that could actually be like a preventative measure. If you're looking at that and you see some differences, then you can proactively support the pancreas.
Right.
That makes sense. Yeah, I like that. I think that's what I look at when I'm looking at all of your products, is that you could, if the dog isn't showing clinical signs, but you can use this as a way to look ahead before they show those signs.
Right. It's a spectrum. You don't wake up and the dog has enteritis or pancreatitis.
Yeah, especially if you've seen a little bit here and there between the diarrhea intermittently, or, it's let's look into the root cause of these.
Right. And I do see one of the questions is, what's the difference between us and animal biome? And that's one of our number one questions we get. Okay. And, we like animal biome. We recommend them sometimes with some of our markers. We're friends with them. They do a good test. But they're looking at gut bacteria and all the different patterns of gut bacteria and what they may be associated with. We're looking specifically at functional markers and what's actually happening in the gut. So with our 6 markers, they're just looking at what's happening in the gut lining, the digestion. So yeah, that's how we're different. I was going to say the other marker that we look at that test, besides pancreatic elastase, is beta-glucuronidase. That's an enzyme that people make it, dogs make it, cats make it, but gut bacteria also make it.
Okay.
And it's you need a little bit, your pet needs a little bit, but if it's really high, then it's likely coming from gut bacteria. And within the stool, it's going to be from the intestines. It can also, it's related to liver function, but within the stool level, it's going to be from gut bacteria if it's high. So if it's really high, that's when I think, maybe we should, look and see what the gut bacteria is. Okay. And then the other issue with it being really high is it likes to impair detoxification. So glucuronidation is a detoxification process that will use glucuronide molecule to grab toxins or hormones and then escort them out. like putting handcuffs on them and then escorting them out.
Okay.
But beta glucuronidase is like, oh, I like those shiny handcuffs or those glucuronide molecules, and he'll just grab them. And then that toxin or hormone is just free. And oftentimes it's going to be freed within the gut. And so it gets reabsorbed so it can concentrate toxins or hormones. So it's probably a good idea then to kind of do some detox while you're working on the gut.
Okay. So like a liver detox also. And
yeah. Because that's going to be a lot of work if you keep getting all that. There's certain levels in people of beta glucuronidase that are associated with colon cancer. Essentially everything is just getting undone, and it's just, it's like you don't even have the detox process.
Wow.
So we, when it's high, we think about there's dysbiosis. So maybe checking what that is. And then looking at detoxification support.
Mm-hmm. And what kind of detox are you talking about? Like milk thistle, those.
Exactly. So milk thistle, that kind of thing. It in people, and I say in people because I've seen, like, when I was in the people world, we looked at like, oh, this is coming, and they do, unfortunately, it was mostly animal research, so a lot of that's been done on animals, beagles, and then in the pet world, it's like, oh, well, in people, we've seen this. So we're always kind of looking at that transition,
Sure. Yeah, I've always said that's kind of a loop. Like we test on animals, see how it works on people, and then we do it with our dogs.
Right. So in people, if you test and you have all these elevated opportunistic bacteria, then a lot of clinicians, at least in a more functional clinician, would do like oil of oregano or biocidin or different products to kind of bring those down and then reseed. So I think in people, there was always the 4-5R protocol, which now a lot of clinicians are moving away from automatically killing off, and they're going to building up the good and trying to let the whole immune system take over that.
And that's basically what antibiotics does. It kills everything off.
Kills everything, yeah. And mostly everything. I mean, sometimes you'll see, like, especially in people, everything mostly gets killed, certainly the commensals, but then an opportunistic will suddenly do well.
Yes. And so that's what I don't think a lot of pet parents understand, that when they put their dog on metronidazole, it's killing not only whatever is causing the diarrhea, but a lot of those good bacteria.
Right. And they do a lot of things. I think they're not, there are so many compounds. I think people are probably, familiar with like short chain fatty acids or butyrate. There's some bacteria that will produce butyrate. So sometimes giving butyrate can kind of support those. Okay. But they do a lot of other things. So gut bacteria will ferment proteins. They'll ferment polyphenols, and there are hundreds, actually thousands probably of compounds that are being made by gut bacteria. And some of them are good. Some of them can cause problems. But so getting that whole balance, and when you get antibiotics, it just kind of brings the whole thing down.
Well, that takes us back to the clinical sign of mood change. So the gut bacteria produce a lot of the modulators for mood and behavior, right?
Yeah. So there's, neurotransmitters get made there. And so you can, look at those. You can look at some of those breakdown products in the gut. But that's what I'm kind of seeing next in the human world. I mean, in the pet world, the human world is really into looking at organic acids and breakdown products of neurotransmitters or products that go up if certain nutrients are missing. So I'm waiting for that metabolomics. It's going to take a lot more research than a small company can do.
Sure. Well, that's really interesting, though, to think that we could look at those as other markers of what's going on, especially for dogs with aggression or other behavioral issues.
Yeah. I mean, I don't know why it wouldn't happen, but it's just going to be money and time.
Right.
Like everything else.
So somebody out there, let's get this project going.
Right. Yeah. Why my house isn't cleaner? It's money and time.
Yeah.
So a lot of things. Yeah. But I think that, when you wipe out the gut, you don't just wipe out the bacteria, you're going to wipe out all the compounds that they're making.
Mm-hmm.
And then sometimes certain compounds will increase that we know are negative, like a P-cresol is going to be made, or different secondary bile acids.
Yeah, that's interesting. I think people just don't realize, myself included, just how much the gut does. Like, it's really, we are feeding that when we eat, right?
Yeah.
Yeah.
Yeah. I mean, when they say 70% of the immune system, they mean it, because it's all happening right there. So it's probably, going to have more in your small intestine than in the large. That's really concentrated water, but it's still coming through.
Mm-hmm. So speaking of the small intestine, are there any specific markers that you look at for, because I know there's a specific disease with small intestinal bacterial overgrowth that you could differentiate with what's going on?
Well, I mean, even in the human world, we tend to look at, dysbiosis in general. So you're not going to have like the small intestine's terrible and the large intestine's like, it's fine. All that stuff. It's like always moving one direction. I mean, It never goes back. It's always moving. So it's always taking things out. So sometimes that bacterial imbalance will be in the large intestine more so, some will be in the small, but it's going to impact a lot of things. So we don't have a specific test. Even in the human world, it's hard. Like breath testing, methane is, a lot of a lot of oral bacteria secrete methane. So in the gastrointestinal research world, that's, controversial.
Yeah.
But I still think that, getting good gut health is going to help the whole gut. You may not be able to specifically see everything.
Okay. So you would basically do some of the same remedies, whether you're suspecting small intestine problems versus large. You're going to tackle it the same way.
Yeah, because we're looking at pancreatic elastase that gets secreted into the small intestine.
Okay.
And then, how much is at the end. It's the same like when you look at short chain fatty acids, 95% of those are going to get absorbed before you see them in the stool. And then you just kind of backtrack if this is just 5%, how much is that?
Yeah, that's interesting that you really can't really quantify it then if the body's working correctly, I guess.
Yeah. And I mean, just like gut bacteria, we look at fecal gut bacteria, but there are studies, like there's a lot of research where they're looking at the actual tissue, like looking at the colonocytes, and that's going to be different than what's in the stool. I mean, they're close together, but it's just not as easy, obviously, to test.
Right. Right. So we just came up with a new question. I have a fear reactive and generally anxious dog. Which test would you recommend I do for her? Should I gut check her?
Yeah, I mean, we always generally say go for the comprehensive, because it just throws a wide net. And then you can also see the severity of it if there's other markers. If I had to just pick one, I actually don't have the box. We have one other test called the basic gut check, and it's zonulin and calprotectin.
Okay.
So if I had to pick, if you can't do the comprehensive and you just can do the smaller one, then I would get the basic gut check.
Okay. Interesting. That's great to know. Yeah. So it really depends on what's going on, what clinical signs your dog is showing, and how they respond to different therapies. Yeah.
I mean, you could, try all different therapies over time and keep really good records. And, our thing is test, don't guess. I mean, we won't know. Some dogs have skin reactions due to gut issues. Some of them have skin reactions due to external things that they're experiencing. So we don't really know. I mean, there's only a finite number of symptoms. I know, when we're building the website, they're like, well, what symptoms cause this? And it's like, well, that could be for that or this. I mean, you just don't know with a particular animal. So it's hard to really put down. I mean, a pet that has poor digestive function may be more likely to have diarrhea, because they're not digesting things well.
Sure.
But so could a lot of inflammation.
Right. There's so many non-specific clinical signs that you see, and then that's why it's hard to get to the root cause sometimes, right? Like,
Right. I mean, that's why we started with these markers, because we felt like they were just more actionable.
Okay. Do you foresee bringing on more tests?
We do. Yeah. Yeah, we're a small company, so it's like, okay, let's try this. We're always getting more ideas than we have time.
That's what I would think, that it would almost be like cascading. Like, wait a minute, I want to know more about that. That would be me.
The phrase we hate the most is like, it would be a good idea. It's like, yeah, we know. There's lots of good ideas.
No, don't say it. Don't say it. That's great. Well, I want to give you a chance to let people know how to find you, how to get your product. And I know you also have a code for them to put in for this live, that they can get a discount. One of the things I did not mention is that we have that you're going to be a partner at the Feed Real Summit. Are you going to be there yourself?
Hey, that's the one in Florida?
No, in San Diego.
In San Diego, okay. They just tell me where to go.
Where to go.
I'm not sure yet if I'm going to be at that particular one, but somebody will be there. Yeah. So, and you can talk to them, or you can always email us.
Okay.
So
excellent. Yeah. So we put up here 15% off with the code GUTCHECK at innovativepetLab.com. Is that correct?
I believe that's right. I was just texting.
Sure. I get that.
Yeah. We're always like, oh, well, we do this too. We're, because we're a small company, we kind of handle everything.
I get that.
But yeah, so if Lacey sent you that is the correct code.
Okay.
Yeah.
And then for all of you that have not gotten your Feed Real Summit tickets, unfortunately, it is a sold out event. However, we do have a wait list, and we're hoping to pull some people off that wait list. If you're really wanting to come to that, you can go ahead and get on that wait list at feedreal.com/summit. We would love to have you on there. Is there any other questions? I think I went through all of them that came up. Yeah. So if there's any last minute ones, you guys can ask us real quick, because we're running out of time. Is there anything else, Betsy, that you would like to say?
No, I mean, I think that's it. It seems overwhelming, but it really is just 6 markers that look at 6 kind of different areas that also kind of overlap. But we have an interpretive guide that, kind of goes more and it's referenced on the test itself. You can look at a sample report, and then more information is on our website. Sure.
So the website would give you indications of what test to run and.
Great. Yeah, they do. Because that's also besides how are you not like animal biome is what test should I do? So we do cover some of that.
Good. Yeah. And that's always, really important. For people to be able to understand what it is they're wanting to look at. And there's just so much information out there.
There is. Yeah, there's a lot. So it's innovativepetLab.com.
Perfect.
And it will.
Okay. Well, I think we've about covered everything that we need to. Our time is running out. I thank you so much for sharing your time with us. And I look forward to talking to you or one of your reps at the Feed Real Summit in October. And we will talk to you later and look at your products.
Okay, great. Thank you so much. Thanks for having me on.
You're welcome.
All right. Bye.